of Health. Tonight, the Washington State Department of Health, along with Public Health Seattle-King County and the Snohomish Health District, are announcing 2 new cases of COVID-19 that we are classifying as being presumptively positive. This means that the test has come back positive here in our laboratory, here at the Public Health Laboratories, and is pending confirmation at the Centers for Disease Control and Prevention. We are fortunate enough to have Dr. Jeff Duchin here from Public Health Seattle and King County, and he is going to give you some additional details about the resident from King County who has been found to be presumptively positive for COVID-19. And we also have Dr. Chris Fitters from the Snohomish Health District. He is the health officer at the Snohomish Health District and is going to tell you about a resident from Snohomish County who has tested presumptively positive.
Thank you, Kathy. As Dr. Lofi mentioned, we do have a new case of coronavirus in Snohomish County. We've received a presumptive positive result from the state lab today for a school-aged adolescent. This individual became ill on Monday with fever, body aches, and a headache. They were seen at 2 different clinics, both in Snohomish County, over the course of the week. As the student was feeling better, they did attempt to return to school at Jackson High this morning. The results came back and the student was promptly notified and returned home before attending class. The individual is currently in home isolation as well and is doing well. There was no travel history associated with this case. Our team is still in the midst of the contact investigation, so we do not yet know the possible source of infection. Our staff have notified a very small number of students who came into close contact with the individual, and those students are to remain at home for 14 days. The Snohomish Health District will conduct symptom monitoring during that time. We are closely working alongside the Everett Public School District to ensure the continued safety and health of students and staff at Jackson High School, and I have personally spoken with the superintendent, Dr. Saltzman, and many of his senior leaders, and they have been responding swiftly to this news. They are preparing to sanitize the school's campus over the weekend and are intending to remain closed on Monday. We are also working with healthcare providers in Snohomish County to notify the healthcare workers and any patients who may have come into contact with the new case at the site of care. At this time, there are no additional areas of concern. I can appreciate the news tonight can be distressing to our community. The most important thing we can do is to remain calm and prepared and informed. I encourage you all to monitor reliable news sources, particularly the CDC, Department of Health, and Snohomish Health District websites, and other local public health authorities where you live. We are also actively updating our website during this very fluid situation. I'd like to turn it back over to Dr. Lofi.
Not yet. You get Dr. Lofi again in a minute. I'm Jeff Duchin. I'm the health officer for Public Health Seattle and King County. And I'm here to share with you that we have a preliminary positive result for COVID-19 in a woman in her 50s, a female who traveled to South Korea, was visiting in February, earlier 7th to the 23rd, returned to Seattle and worked for 1 day on Tuesday and noted symptoms at the end of the workday when she got home on Tuesday. And on Wednesday evening, her husband called to report her symptoms and travel history to us, and we had her tested yesterday in collaboration with our colleagues from Harborview. They did a home visit and a home testing, and we got the result this afternoon, which is preliminary positive. This patient never needed medical care. She took care of herself at home, had fever, cough, some nausea, headache, sore throat, and like the vast majority of people who have COVID-19 infection, is recovering without complications. She never did need medical care. As I said, she's improving. She has had no interactions with the public during her day at work and has not been in public since her symptoms started. We're in the process of doing a workplace investigation, a contact investigation, and her husband, important to note that her husband, who's been living with her during this time, although he did not travel with her, is well and without symptoms, and he is now under home quarantine. So this is a case of travel-acquired infection, not community-acquired infection. Although, as you know, we have the ability to do more testing now, we will expect to see more cases, including community-acquired cases at some point. So I'll turn this back to Dr. Lofi, and we can take questions.
Great, thank you to both of you. I also want to recognize that this news may be concerning to some people. We appreciate that people in the state are taking, this public health threat very seriously and continuing to seek information about how to stay healthy and to get prepared. Some simple steps I want to remind people that they can take to prevent the spread of infections include washing your hands often with soap and water, staying home when you're sick, covering your coughs and sneezes with a tissue, and cleaning frequently touched surfaces and objects. In addition, people should start making plans for what they might do if their child's school closes. For example, the situation that we're in now in Everett. And people should also make plans to check in. People should also check in with their work about their sick leave and telework options should they need to take care of somebody who is sick at home. As always, our number one priority is the health and safety of the residents here in Washington State. We are very committed to keeping you up to date on this situation and to let you know about developments as they are occurring so that you all and everyone can make good decisions about how to best protect themselves and their families.